the health agency.
Ang goal namo is to provide really quality patient care, which is which is geared towards patient safety and client satisfaction. Yeah, our quality objectives is to provide affordable, sustainable, accessible healthcare delivery system that is for providing quality maternal and child health nursing to our client, that is geared towards the patient safety and client satisfaction. So more or less, our target is for client satisfactions, and we are committed to provide safe and quality.
What are the existing policies or thrusts or strategies in order to meet the goals and objectives?
Strategies, no? So much so that it's so timely that we have our 5 years developmental plan. We are preparing the 5 years developmental plan that is for 2013 to 2018. And in our plan, we analyze on the SWOT, nag-SWOT me. What year are you? Second year. Medtech? Okay. We started with a SWOT analysis. We identified the strength, the weaknesses, the opportunities, and threat. Then we come up to the issues and concern. Then after coming up with the issues and concerns, so we set our strategies, we set our objectives and strategies, and we identify point person as person responsible for each of the objectives and strategies that we have planned. And we divide also, we included that we have target, we have budgets, we have indicators, and for that we have so many committee to work on the different strategies that we have. Like for example, we work on the to reduce the unmet problems, to improve our family planning program. We have also the Manchan, the maternal newborn child health and nutrition as part of the program, APM's Manchan. And we have person, we have committee, we set a committee because one of the family planning and Manchan is to reduce, related to the Millennium Development Goals. So what are the 8 Millennium Development Goals? Is first we have eradications of poverty, eradication of extreme hunger and poverty. So much so in that Millennium Development Goal, as part of the personnel in the Department of Health, reduce poverty and hunger. So we are promoting lactation management, the exclusive breastfeeding. Why? It reduces economic costs of the mother and the patients who will be breastfeeding their baby. At least by that time, they are not spending for survival of babies. So more or less, we are promoting breastfeeding, exclusive breastfeeding. And in the Manchan also, the attachment more on the maternal bonding of the child and baby, so it improves, no? Then the second Millennium Development Goal is more on to achieve on the universal secondary, primary and secondary education, so much so that I think the Department of Education is now on process of improving, no? So we are free education from primary and high school. Then we have to promote gender equality and development, so much so that we are also promoting the WCPU, the Women's and Child Unit, in which there will be equal opportunity for men and women, even at the job. So there is no more discrimination, regardless you are a man or a woman. So equal and violence against gender-based violence, more on volunteerism, import choice and volunteerism, even in our giving our services, especially to the to the pregnant mothers, no, to the babies, to the children. And in the Department of Health, one of the strategies that we have is we have to reduce infant and child mortality. So by reducing that, we are promoting immunization, we are promoting deworming, the supervision of the 0 to 5 years old, and we are giving vitamin A immunization to children to have a healthy children. And also in the Millennium Development 5, we have to improve maternal health. So by improving maternal health, we are giving prenatal, also the antenatal, and the postnatal. So more or less, we are giving also pregnant mothers ions and vitamin A, and more or less closer prenatal. So that is only for the strategies, no? And also in the cancer program, we are promoting the CCAP, the cervical cancer awareness program, in which instead of pap smear, in which the parents are now paying pap smear, we are promoting the vinegar. The CCAP is we are using vinegar to assess whether there is now early signs and symptoms of cancer, especially the cervical cancer. Although we have immunization to that, but that is to improve our maternal, no? Okay, so what else? Now, so strategies, so different strategies and program in terms of services. Here we have the OPD, we have the emergency room, we have the pharmacy, and we have the ER, and all the different areas have its own concern, has its own strategy to improve their department. So in the nursing service, you are med-tech, no? Okay. Like for example, in laboratory, no? So in the laboratory, we are promoting one of the program that we want to improve child, the infant and child, is more on the promotion of our program, the so-called newborn screening, in which we implement the RA 9211, it's 9288. So in newborn screening, in which after the delivery, 24 hours after delivery, then we encourage the mother to submit their child for newborn screening in order to identify the 5 diseases that can be identified through newborn screening, no? So we encourage them, and we have a good percentage of compliance and achievement, because the payment is they are no longer paying for newborn screening, but it is now the package na so once they delivered, included na in the package free newborn screening, so that there will be a higher percentage of accomplishment. So strategies is we have another program as part of the improvement of healthcare services, is we have the waste management, the proper disposal, segregations, and collections of our waste, especially the pathological and the infectious waste. And one of the strategy also is the infection control program, in which twice a year we do comprehensive cleaning, no? So that more or less, if ever there will be infections, so pseudomonas in the hospital, because the increased number of client that we have, especially from the different municipalities, because we are catering, or we are accepting patients referral. If the Senti Soto or the tertiary hospital will be closed for cleaning, so Soto will be closed 3 times a year. CCMC also will be closed 3 times a year. So on that days or weeks, all patients supposedly sa ilaha, they will be transferred and referred to us. So naturally, we have to prepare all the facilities that we have. We prepare our staff our doctors, and the time is more or less we maximize our time and able to deliver the services as expected by our clients. So and there are so many strategies. It's so timely that we are preparing the strategies for our development.
How is the flow of function and responsibilities of the healthcare system of your agency?
The structures that we have is, we have the chief of hospital. And under the chief of hospital is the 3 division, the nursing service division, the medical and ancillary service divisions, and also we have the administrative services. So that is under the 3 division is under the direct supervision of the chief of hospital. But each of the division, there is somebody who will lead. So, like for example, in the nursing service division, it's headed by the chief nurse. In the medical, we have the medical specialist. And in the admin, we have the administrative services. So, that 3 is line function. They are under the supervision or direction of the chief of hospital. But these 3 division is headed by the different, example, chief nurse. Ang ilaha is more on lateral in terms of the structures because they coordinate with each other. So, ang line ni Ana is a dotted line, meaning coordination, consultation, and more on helping each other, coordination. And each of the division has its line function na siya mga sakop. Like for example, in the admin, they have the cashier, the accountant, the dietary, the purchasing division, the supply, the billing, no, is that. And in the nursing, it's headed by the chief nurse. We have under the chief of nurse, we have the nurse supervisor, we have the head nurse or the senior nurse, and that under the supervision of the head nurse is the staff nurse and the nursing attendant. So that is our structures, and our structures is posted outside, no.
What are the most common illnesses experienced by the people in your catchment area?
Is pneumonia and gastro. In fact, we have ward for pneumonia and gastro. So, more on the upper respiratory, the RISPA unit, and the gastro unit. So, that's the common because we have our monitoring and surveillance every day. We will report to the city health whatever is notifiable disease and the infectious disease that is encountered by our hospital. So we give our monitoring and report daily. Then, so in case we have infectious, like for example, gastro, pneumonia, dengue, malaria, or whatever, it's reportable to the regional epidemiological surveillance.
What are the most common causes of death in your catchment area?
Not only the hospital, it's the catchment, because we have also catchment area. The hospital being in the south district of Cebu, we have a catchment area of 34 barangays and almost 400 population. No? And I think the common also is pneumonia. And
in response to the health problems affecting the community residents, what are the health services provided by the agency?
I said we have posted our different services. We have the outpatient department. We have the outpatient department, and our outpatient department is implementing all the trust and program of the Department of Health. Like for example, the immunization, the under 5, we have programs for senior citizens. We have more on laboratory. We have dental. So that is for OPD, and we have the pharmacy. No, the distribution, of our purchasing of medicine, no, with the prescription of the doctors. We have the radiology department, in which there are X-ray and there is ultrasound. And we have the emergency room for admission of the OB/GYN pediatrics, But if ever, since we have no room that can accommodate adult or male, because we are OB/GYN pediatrics, we just stabilize the patients, and after that we have to refer. But for those pedia or OB, it can be admitted to our hospital because we have DR, delivery room, we have labor room, we have OR, but our operating room is also limited.
What is the ratio of health personnel to the care recipient?
So that's madugo na question because being a government hospital, we really accept that there is a limited staff. In fact, we are doing multitasking. So since we are 25 bed, our total number of personnel is only 56, no? And in terms of ratio, in shortcut computation for nurses, if we are 25 divided by 3, supposedly we have 8, more or less 8 to 9. But our number for the nurses, we are only 1 chief nurse, 2 supervisor, 2 head nurse, 6 staff nurse, and we have 6 nursing attendants, so total is 17. But we are augmented because we cannot give quality care if that is only our staff. So we are augmented with the RNHs, the registered nurse, health enhancement, and local services. So we have 22. They will be staying with us, or they will be working with us for 1 year. They are paid by the government under Pinoy project, the Kalusugan Pangkalahatan, or the KIPI, or the AHA, Aquino Health Agenda, or the UHC, Universal Healthcare Project. So they are 22 of them will be from January to December. And last year we have also, because they will stay only for 1 year, another batch. So more or less, if we have to compute also, because there is a standard computation of the staff per Latino, it's like this. Okay. For the nursing, I can talk only for nursing services, so that is example. So if your bed capacity, if your bed capacity is 25, for example, the 25, we have to, it depends on the classification of patients, because in the 25 bed capacity, more or less, we consider that as before we have the secondary hospital. But at present, in the classification, we are categorized under level 1, but special hospital. So we categorize our patient, example for 25 bed. So we considered 65% of our time, 65% is for minimal care. So example, if we are 25, you multiply 25 by 65%, so that is the expected number of patients that needs medical care. And also for the 65, and 30% of our patient is for moderate care, and only 5% of our patients is considered as serious, more considered as needing special or intensive care. So we also, we compute the nursing care hours, because if for minimal, the total number of hours given to the patient for 24 hours is, for special is 6, for moderate is 4.5, and for minimal is only 3 hours in 24 hours. That's the standard. So we just compute how many nursing care hours needed by patients to total patients, and we compute, and we can now reach how many nurses do we need for morning duty, for afternoon, or for night, because 45% of the nurses will be shifted to morning, and 37.5% of the nurses will be in the afternoon, and it's only 18% of the total force or staff will be for night, because sa night the patient is no longer active, their demands is less compared to the morning. And in the morning, nurses are very busy carrying out doctor's order, laboratory, and one, no?
What is the ratio of healthcare facilities to care?
There are so many healthcare facilities. One is your bed. So in your bed, there are patients 1:1. But in times of crisis, daghan ang pasyente, we have observed that one ano man na to tandem. So more or less, if this is the bed, one patient, if ever dili kaidaghan ang pasyente. But during the crisis, when some of hospital will be closed, the two bed ano siya itapan. Then instead of 1, 2 only, we can maximize 2, 3 or 4 occupants. Hospital program for infrastructure project. The new building nakakita mo, you have at the back, the green.
How do you solve the issue of lack of health personnel and healthcare facilities?
Segmentation, so much so that during the time when Soto is closed for cleaning and older patients will be referred to us, and also CCMC will be closed for cleaning and patients will be referred to us. One of the solution is we have to augment. We will be asking the support of the administration to hire contractual. So for that example, 1 month, 2 months, just to augment the understaffing. And for the health facilities, if ever wala jud, we don't have that, we have to refer it to other, like for example, laboratory that is not in the hospital. We have to have our MOA with the high precision, with others. So it's more on the MOA. So more or less partnership. It's more on partnership. Is more on the agreement of 2 hospitals. So it's related to public-private partnership.